So I'm going to talk about Buddhism and animal health. And for this, I'm going to specifically take the example of rabies because it's a very common disease and all of us deal with it all the time. So, and then I'm going to take a few case studies and look at how we approach rabies from human medicine perspective as well as from animal medicine perspective, and then what Buddhism can offer in terms of, the various public health perspectives also. So, first of all, we know rabies. Rabies is mainly it is caused by animal bites. In India especially, we have a very high burden. So, rabies is the 10th biggest cause of death due to infectious diseases all around the world. And around 36% of these rabies deaths are caused in India. The mortality occurs in India every year. So, we carry the highest mortality burden in the world for rabies, and we know that rabies is a zoonotic disease, which means it gets transmitted from animals to humans, and humans become the dead-end host for rabies. And it causes acute viral encephalitis, and the mortality is a given. But what we have found in our area is that if there is an annual vaccination percentage of around 70% of the dogs, because 95 to 96% of the rabies is caused by animal bites, dog bites. So if annual vaccination of around 70% of the dogs is carried out specifically, then it eliminates the viral perpetuation. Viruses don't get transmitted. And the problem with rabies is it affects the most vulnerable population of our land. So mainly the children and then the lower socio-economic classes. And in the studies that were carried out for rabies, only 70% of the population had even heard of rabies. They didn't even know that, 30% did not even know that rabies existed. Out of that, only 30% were aware that they have to wash the wound after an animal bite, and most of the patients were non-compliant with the treatment. So it is only in 2021 that India made rabies a notifiable disease. And unfortunately, in 60% of the fatal rabies cases, the 60% of the rabies cases, they had tried herbal treatment and they had tried traditional medicine before approaching our physicians. So we will look at two case studies. First is a very interesting case study from a state of Gujarat. So in Gujarat, 70% of the population is classified as rural. And in Gujarat, 15% scheduled tribes exist. 7% is classified as scheduled caste. And in this scheduled caste community, there is a very, very interesting case study of a goddess of rabies. She is called Hadkai Mata. She is probably the only goddess of rabies in the world currently. There used to be a goddess of rabies in the Roman times. So this goddess, she exists only in oral tradition because she belongs to our community and it is passed down in the oral tradition. And this goddess, she gives you rabies and she can also cure your rabies. So that is the tradition that we have. So first of all, like I have already introduced Gujarat to you. Now Gujarat has a very dubious reputation in terms of rabies. So there are 19 dog bites per hour. This was in response to a Lok Sabha question in 2022. And but we have Hadkai Mata to help us there. So it is said that it is a men-only temple. So there are temples of Hadkai Mata, and incidentally you can even buy this statue. I found this on the internet. You can buy a Hadkai Mata statue. And so what she does is there are buas and sevaks who are only men, and these men, they belong to the scheduled caste, and they don't take any money to affect a cure. So what happens is if a dog bites you, then that dog, it means that you have done something. So it is very, very different from the Hindu traditional way of looking at a disease. Because in Hinduism, that disease comes to you externally. Whereas what Hadkai Mata says is this disease has come to you because of something that you did. So it is very interesting why the dog bites you. One of the reasons is lying. One of the reasons is that you have dishonored your promise. One of the reasons can be that you have stolen. So to me, this sounded very similar to our Panchashil, that the reason that Hadkai Mata has bitten a person is because that person has broken a shield. But of course it now has been appropriated in the Hindu tradition. And the thing about Hadkai Mata is the buas and the people who are officiating at the temple, they follow the caste system. So if a lower caste person is bitten, that person is not going to be allowed in the temple. Any dhaga or any cure that the bua does will be done outside the temple. So this system is still followed there also. And 3.5 days is supposed to be the time period that the Hadkai Mata works. And this goes against the allopathic medicine, because allopathy will say that you come to us as soon as possible, within 24 hours if possible, and first of all you wash the wound and all that. So this, post-exposure prophylaxis becomes very difficult in this kind of a case. So more than the fear of the disease, it is the antisocial behavior which is feared more in this case, and which is why it becomes very difficult for physicians to work in this area. And mass dog vaccination is disliked in this area. And in fact, even in a state of, a place like Ahmedabad, it was found that 61% of the interviews, they were not aware that rabies causes fatality. They were not aware of post-exposure prophylaxis. And in another important place like Anand, only 6% of the respondents believe that if you vaccinate a dog, then the disease to human beings is reduced. So this is one faith-based healing that we have seen in our field. Then secondly, another of our neighbors, and that is Goa. And I was a part of this organization. I have done a few workshops here. More importantly, I was a part of Mission Rabies, where I worked for 2 years as a doctor and a surgeon. So Goa is very important for us, because Goa is the first state in India which is declared as rabies controlled area. And what worked for us in Goa was we had the sea on one side, and then we had the Western Ghats. So we had to, after working in the state, we just had to monitor the state borders. And that is why we were very successful here. In this, what was very important for us is how closely an NGO where I worked, Worldwide Veterinary Services, and the government of Goa, how closely we worked together. And we were able to bring down the number of dog rabies, like rabies in dogs. Though that case reporting, we were able to bring it down to almost 92%. And the fatality in human beings also was reduced remarkably because of this. So in this so this program started in 2013. And this program was called by WHO as very, very cost effective. So even cost is something that we took care of. So this came under the One Health approach that we followed, and we had a 3-pronged strategy here. The first one was to eliminate human rabies death by completely reducing the rabies incidence itself. So we aimed for mass dog vaccination. So our research had found that if 70% of the dogs are annually vaccinated for a period of 3 years, then the virus perpetuation reduces. And in fact, it goes down to 0. And then we tried to do this in Nagpur also. For 2 years, we were able to successfully do that. So first step was this mass dog vaccination, which we did highly successfully. And then the second was education. So we did mass contact with schools, and almost 2 lakh children were, 2 lakh children and some 32,000 teachers. We taught them about rabies, what kind of a disease it is, and what kind of prevention measures are important if we want to make sure that children and the adults are safe from rabies. And then the third pillar was a rabies surveillance. And as somebody coming from the background of software, I really appreciated it. So there was a Mission Rabies app. And in that app, every one of us who was working on the field, who was working in the hospitals, all of us had access to the app. to immediately notify if where I am, which dog have I vaccinated, is the dog showing any kind of symptoms, etc. So this kind of an app made sure that our managers sitting wherever in the world, they had continuous access to real-time data about what was going on in the field. So this app worked really well for us. So this all, it came under the One Health approach, which in fact this One Health approach came to us in 2009. And then of course Mission Rabies worked on that. So the One Health approach has coordination, collaboration and communication between all the stakeholders. So it is one world, one health. So all of us, like human doctors, animal doctors, public health professionals, lawyers, social workers, all of us, we come under this approach. So this is just, that health of humans, domestic, wild animals, plants, we all are interconnected to each other. So this was the approach. However, I just want to suggest about, if we were to look at Buddhism and animal health, if we were to approach Buddhism not from a traditional way, not from a Western way of medicine, but from a Buddhist approach, which, Shankar sir has already spoken so much about it that I feel, maybe I'm repeating, but I'll just add a little bit more from my patients. So if we were, our patients also go through 4 Noble Truths, and it is applicable entirely to them also. So just like there is suffering, we know that animals also have physical and mental suffering, and the Buddha has also said that there is a lot of suffering in the animal world also. There is a cause of suffering, and the cause of suffering can be anthropogenetic, so we have caused it also. Human beings can be the cause of that suffering. And of course, because animals are also alive, they go through aging and death, so that suffering is also there. But if we know why we are causing this suffering, so at least the cessation of suffering from our side can reduce. And there is a path to end animal suffering also. And as far as mapping the Eightfold Path to animal health is concerned, that is something that I want to ongoingly work on, as well as work with Pratitya Samutpad and animal health. So I think Shankar sir has laid a very good foundation for human beings, so I'll just work on his model and take it up to how it will work with animal health also. So instead, I think instead of just one way of looking at it, I would like to propose a Maitri approach to animal health from a Buddhist perspective. So this Buddha and his Dhamma, in this Baba Sahib has written it very clearly that the Maitri approach would be to make the world a kingdom of righteousness. And when Baba Sahib uses words like the world and righteousness, he is not, just to focus it on human beings would be wrong. We know that he meant the world in its totality, probably the multiverse in its totality. Many suttas and even the Vinaya Pitak, they talk about animal suffering and how not to cause animal suffering in any way. And in Buddhism, there is a value of animal life. Buddhism talks about compassion, non-violence, and Buddhism is very clear about the dietary practices that we need to follow if we are to reduce animal suffering. So in the chapter on Sadhamma that is there in Buddha and his Dhamma, Baba Sahib has written this, that what is Sadhamma is to remove misery and righteousness in our conduct in relation to each other. And it would be very simplistic of the Buddha and Baba Sahib if they just meant the human beings, because they meant the entire world. And we have to, train our instincts and dispositions, and we have to have the courage to stand by what is right, even if one is alone. And at the same time, there are 4 pillars of Sadhamma. So the Maitri approach, instead of just being a transaction between the human and animals, the Maitri approach, if it has these 4 pillars, which talk about health in general. So the 4 pillars of Prajna, Shila, Karuna, and then Maitri. And then maybe we can have a more wholesome and a holistic way, like our Ramteke sir also said, that a wholesome view of looking at things. So same way we can develop a more wholesome way of looking at how these worlds interact with each other. And in Buddhist way of life, Baba Sahib has said very clearly that we are not looking at a high standard of living, but we are looking at a high standard of culture. And when we talk about high standard of culture, we have to encompass all the beings, all the sentient beings that are here. And yes, health is the greatest benefit of all. So it is the greatest gift. So thank you very much. Jai Bhim, Namo Buddha.